right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode today. For many of you who follow podcasts, one of the subject matters that we discuss often, because it's a very common procedure done in the United States, is abdominoplasties. That is surgery to reconstruct and recreate an abdomen after, say, for example, someone's had children or have lost weight. And we've done several podcasts regarding this in different areas. Maybe it be focused on the diastasis, maybe it's focused on if I've lost a ton of weight or if I have a hernia. But today's episode, I think, is particularly useful for individuals who consider themselves sort of naturopaths or holistic, or people who pride themselves on sort of not having plastic surgery. You know, there's sort of this duality that plastic surgery is synonymous with the idea of sort of going on to the dark side, somewhat perhaps even cheating, or that if I were to live my life in a very health conscious spiritual way, I could somehow avoid having to do something that's vain driven or vanity. Well, we have hundreds and hundreds of patients that are holistic, and I mean that in an umbrella term. Birkenstock wearing, they ride bicycles, they are spiritual people, and yet they find themselves at plastic surgeons' offices, because one thing we know is that giving birth to children, for example, is going to change you in a way that no type of vegan diet or mantra is going to fix. So those people find themselves in a unique place. And one of those people is one of our patients who's joined us today, Sandeep. Thank you for coming.
Thank you for having me.
First of all, we always appreciate when people come on the show, because in order for the show to be effective, people have to relate to it. In order for people to have to relate to it, they got to hear more than just me reiterating or regurgitating or dictating a bunch of information. We want to know it through the eyes or through the experience of an individual. You were kind enough to be on the show, and through you, we're going to sort of emulate or discuss some of the things that I think are relevant. Why we enjoy having you on the show today is because when we met, it was apparent to me, and since then, that you live sort of a naturopathic type lifestyle, and I'll let you elaborate to what that is. And so I think if you're at home and you're thinking to yourself, yeah, but it's plastic surgery, I think you want to listen in. So tell me a little about yourself. How old are you? How many kids do you have? What did we do? When did we do it?
So I am a mom of two kids. I have a 14-year-old and a 9-year-old. And this was one of the best decisions I've ever made. And I'm going to be 42 this year.
Fantastic.
Thank you. And so I'm 2 years post-op.
2 years post-op. Okay, yeah. So here you are. And explain to me, if someone were to describe you as holistic or a natural individual, what that means to you is the way you understand it. Because we want to set the landscape of, I wouldn't claim myself to be a holistic individual. My wife perhaps, but me not. So what does that mean to you, so that if someone's at home, they're like, yeah, that's kind of like how I live my lifestyle?
Yeah, I always say, I'm equal parts grit and granola, that I'm very pragmatic, but I want to do things that are more natural, And so for me, the word holistic means, how am I viewing this from a full body perspective?
What do you guys do in your life that considered, say, holistic? Do you have a certain dietary approach to things? Are you guys perhaps more spiritual in regards to certain things, and you execute more spirituality? What really is the nuts and bolts of your natural way of living?
Yeah, so being South Asian, spirituality has always been a through line in my upbringing and existence. And I think for us as a family and me as an individual, I eat a really healthy diet. I do my best. I eat a little bit of everything, but I've always been active in taking care of my body, because it's the only one I have.
Okay, so here you are, you have these two beautiful children. I'm sure you have always eaten well. I'm sure that when you look in the mirror a couple of months after your second baby and you're like, I don't look the same, you probably ratcheted down and really honed in on your skill set that you already knew to be true, sort of this way of life, sort of mind, body, and soul sort of approach. And despite all that, you reached a level where you couldn't get to that place that you perhaps wanted or felt you ought to be at the age of 39 or 40. So, you had some excess skin, and you had this protuberance or bulge or muscle weakness, and we can describe it 100 different ways, but really what it comes down to scientific is this separation of your muscles known as diastasis, and that combination leads to not a very healthy core, right? And I'm sure you did everything under the sun to try to avoid ever coming to someone like me, right?
Yes, yeah. And that was part of my journey. I think that's the struggle that no one really speaks to, is that I really tried to feel at home in my body. You know, I had these 2 beautiful babies, I had 2 home births, and I had the privilege of nursing my kids until they self-weaned, and that was 7 years total of nursing. And afterwards, I really tried to do everything. And I think your core, you know, it's your center. And for me, always being athletic and kind of having that agency over my body, I really struggled. I thought, you know, we're programmed. And I think this is kind of the dark side of feminism, and women can be so hard on each other, is that you're supposed to love yourself no matter what, which is beautiful, right, in theory.
Sure.
But I think the most feminist thing and self-loving thing you can do is feel at home. So I tried everything.
What were some of the things that you did that you would consider to be, maybe let's say your friends who are not so holistic would kind of just throw in the towel, but you being true to your mantra, you're like, nope, I'm going to try that, and I'm going to try that. What are some of the things that you attempted that sort of perhaps didn't work?
Yeah, I tried, you know, I was in the gym, I tried yoga, I tried everything to strengthen the core. And it wasn't until I looked at it, and I was actually having a conversation with a friend who was like, you know, if you were an athlete and you had a sports injury and you tried to, you know, work with that injury and nothing was working, you would go and remedy that. And I was like, yeah. And that kind of shifted my thinking about, you know, birth is beautiful, but it is trauma on the body, and my muscles, no matter what I did, no matter what core exercise I did, you know, varying my diet, I had a muscle injury. And the only way to fix that was through surgery. And so I had to sit with that. I had to sit with that of, all right, I've tried everything, and this is the next step. How do I really feel about it? And so that kind of shifted my thinking of, again, of just feeling comfortable in my own skin.
Yeah, and the thing about it is that, and there's 2 points to this. There's feminism and the ideology of loving yourself, and then there's the world of being a naturopath or holistic person. And interestingly enough, no matter where you stand, you're past judgment. So if you're a devout, orthodox, whatever, you pass judgment on the secular, and it doesn't matter where you are, your vantage point is, there's going to be an alternative. And so from the standpoint of feminism, which is a wonderful overall cause, because I if anything, I feel like I'm part and parcel to empowerment of women. There is the, oh my God, you don't love yourself, therefore you went and had something altered to make yourself love yourself. And the same argument is the reverse. I love myself so much that I bestowed this upon myself. I deserved this. I earned this. I want this. And therefore, I'm not going to just sit in misery and just be unhappy for the next 20 years, but rather I'm going to gift myself this privilege, because it is a privilege to be able to do it, and it's available to me and it's accessible, and I'm going to utilize the tools that are available to me to live a higher quality of life. If anything, I think that means you love yourself more than suffering through something. So I think that duality is very fascinating, and feminism is, as you know, just like any other philosophy, has a double-edged sword. The other is in the world of holistic and naturopath, they're judgmental, which is, oh, you're using this alternative way of doing things when your body is your vessel, and everything you need is available to you.
Right.
All the right foods, all the right mindset, you just haven't unlocked it. And there's no unlocking it. You can do physical therapy, you can do yoga, you can do Pilates, and you can improve your condition, no questions asked. But you are not magically going to reattach something that's been torn apart. And until those muscles are realigned, and hence why people have to understand, until you are brought back to your normal anatomy, then your body can function as intended. So you can't, so when we met, what did you weigh?
I was like 125, 126,
so
yeah.
You were skinny, right? You weren't some overweight woman. So clearly you were eating a good diet, because how tall are you?
I'm like 5'4".
So 5'4", 120 is considered fantastic, welterweight. So it wasn't a matter of diet, and you seem pretty fairly muscular to me, but your abdomen was not reflective of the rest of your being.
Right.
I guarantee you, if someone were to see your core today with your six-pack, I didn't make you a six-pack. I didn't go in there and manipulate your muscles and create 6 of them. No, I realigned you into a place where you were back to being whole, if you will. And then you were able to get back on the horse and ride it as far as you wanted. Some patients do nothing and they look good, and some patients take it where you do and they look great. And so it shows you that you were going until we realigned you. You could go further. And you would have never had a six-pack till the days. You could have done 3 million more whatevers because you needed that realignment. So I find it really interesting because it's easy to pass judgment on the vain people, and it's easy to pass judgment on the superficial people because that's a natural trajectory. But in reverse, which is feminism, which is love yourself, we're passing judgment on those that choose another path. And on the holistic side, sometimes we're a little bit critical that, if we utilize some tools, it's somehow unholistic or not appropriate. So one of the things that I thought was unique about your journey, aside from the idea of this holistic element, which is a struggle for certain subset of people, you now currently have a six-pack, right? You can flash the audience if you like, but you're in phenomenal shape. And therefore, what I'd like to do is show people, by articulating it, that the surgery is not all me. My job is to get you to mile 23, right? If we're talking about a marathon. And whether you get to mile 26 is 100% on you. You do, it's all on you. You don't. And I want to talk about what you did to maybe get there, because if you go onto our gallery, it'll probably be maybe only 10% of the patients in their before and afters that become super fit. And that's because they chose to, and they gave what it took to do that. So let's take a quick break, and we'll come back and we'll find out what the secret is. Maybe it's quinoa. We'll be right back after this message. All right, welcome back to the second half of plastic surgery. Let's figure out if it's quinoa, if it's, there's got to be something you're eating or drinking, or some trick, right, in order to get a six-pack, because I want to hear very carefully, because I don't have one and I want one. So we were just talking about it. I'm all about taking credit, and I'm all about giving credit. So never in a million years, given where you were postpartum and when we met, would you ever look the way you did if it were not for me. Never. Because you could never have had the muscle strength, the physiology to build the muscle mass that you built. Conversely, never in a million years would you look the way you do currently if you didn't go to the gym 5 or 6 days a week, eat well, and kill yourself, because we as surgeons don't create six-packs. This is an illusion that people tell themselves, oh, pie in the sky. No, I can flatten you, I can get rid of your loose skin, but I can't make muscle. So for all those haters, you're just a hater, because that's just the way that it is. The truth is that this young lady put in hours, continues to put in hours. So let's talk about that transition. So you do your surgery, I tell you nothing for 6 weeks, nothing. You're not allowed to do shit. At 6 weeks, you come in and I say, you're graduating. What does that mean? It means you get rid of the binder and I need you to go work out. What can I do? Everything. What do you mean everything? What are my restrictions? None. What do you mean none? I'm sure there's things I can't do now that I had an abdominoplasty. None. There are no restrictions. You can do whatever you want. You want to hang upside down? You want to start jujitsu? How about Krav Maga? You want to get on a reformer? You want to make yourself into a pretzel in yoga? Knock yourself out. Obviously, you just had surgery, so it'll be uncomfortable initially. There'll be some tightness and some soreness, but there's nothing that you can't do because I'm going to ruin it. And there's nothing you can't do because of the new restrictions of my body. I'm not able to. So the sky's the limit. Go knock yourself out. And from that day forth till the next time I saw you, you had approximately a year time until I saw you again. And during that year, you get to do what you want to do. You can sit on the couch and have Pringles, or you can go to the gym 7 days a week. So you opted for the latter. So tell me what your routine was and what your recovery was, because as I said, it's unfortunately the minority that get in such great shape. So what did you do?
So I took that time as, I had always had a relationship to fitness, but I say that, you helped heal me and I honed my muscles. And so my relationship to fitness improved because I was seeing results that I hadn't seen before. And that was because I had a muscle injury. And so now I had my core, the muscles repaired, and you gave me a handout. And the handout had, I think it was like 10-second increments of holding a plank and working, my way up to 5 minutes. And I thought, well, shit, I now feel stronger. And it was a mental and physical change for me of having my core fixed. And so I took that to the gym and I thought, you know what, I'm going to work my way up to a 5-minute plank. And so the way I started working out completely changed. A lot of people are like, oh, you must, live and breathe at the gym. I strength train 3 times a week. The other days, I might do core and I'm resting, but that's about it. And the other part is diet. But taking that handout, I remember the first time, even making it to 5-10 seconds was a big feat. And so I know having this surgery is a huge privilege. And, I wanted a 6-pack. I know it's a vain goal, but I really wanted to see, can I shape this part of my body that I used to work out all the time and see very little results. And now that I've healed that injury, where can I take it?
Yeah, I think it would have been total waste. I always get frustrated with patients who come in and who have great potential. It's like we hand you a Ferrari and all you do is go to the corner store and get some coffee with it. Take the goddamn thing on a track and let it loose. And so when I see patients back at the end of the year, I'm praying that when I come in, they're in amazing shape. Every once in a while I look at the thing and they're like, oh, I put on 30 pounds. It's your call, it's your body, do as you wish. But I feel what a shame and what a waste of time, money, and opportunity. Because prior to this, you could complain and say, listen, you don't know what it's like. You haven't had your gut ripped apart from your kids, and you don't know what it's like because blah, blah, blah. But now you have no excuses. Children are not an excuse. I've had 100 moms who come in here, carve out 45 minutes a day, 3 days a week. If you wanted it, that's not the reasoning. So timing is, I don't care if you have 9 kids, you can get 45 minutes out of the day. It's just discipline. It's just discipline, just wanting it bad enough. So it's absolutely your own call, and it's great that you recognized that it was a privilege because you spent all this money. That money could have gone to better items, right, if you didn't use it. And B, that you had this sort of internal challenge. It's not vain. It's not vain to want the most out of your physique. It's a part of health, right? So you wouldn't consider it vain to reduce your cholesterol so the size of your blood vessels is open more. You wouldn't consider it vain for your alveoli to be bigger. So why is it vain that your muscles are stronger? It just happened to be vain because you can't enjoy the look of your large alveoli. You can't look at your carotid arteries that are flowing and be like, wow, the flow is more. But you damn well can look at your bicep and be like, well, shit, that looks good. And that looks great in clothes, and great, I look great in front of my husband, and wow, I like the way I look. It's just a bonus to having good health. It isn't in lieu of having good health or some vanity thing. So again, it's very important that we label things correctly. And I think in the world in which you reside, there's a sizable obstacle that prevents them from utilizing this tool not to be in lieu of, but in addition to your already amazing way of life, right? If your breasts are down here, you're not gonna will them back.
Yeah, I think it's about your quality of life. If anything adds to the quality of your life, do it. And I think that mothers, we judge ourselves and we judge each other so hard. And I think you're damned if you do and you're damned if you don't. So you might as well look at yourself and go, I have to live in this body. I have to exist in this vessel. And what am I going to do to feel the most comfortable in my body? And I think that's the most natural thing that you can do.
Yeah. I just think it's important that we change the titles and terms that we use, because it's easy to create these barriers in individual organized groups, and the healthy, holistic, spiritual, and you're Indian.
Yeah.
Yes. So I've had a massive upspike in Indian patients in the last 5 years, which is a fantastic thing, because Indian traditional Hindu way of life is this is leading into vanity. Vanity then leads to, sort of the degradation of your soul and all those things, which is true. And so for many years, they were the last group to join this party. And I have so many wonderful Indian mothers now that I never had before who are now benefiting from this in terms of the same way you did. So it's interesting. I think it also has a little to do with the culture. You said that it's part of who you were growing up.
Right.
And so it's taught to you as part of your way of life to sort of try to be center balanced. And, vanity is out in the periphery. But this isn't vanity, in my opinion, and my perspective. And the glasses I wear, this isn't vanity the way we see it.
Right.
This is part of that whole, look at you. So right now, I imagine your quality of life in comparison to prior to the surgery, same beautiful children, same beautiful husband, same beautiful job, same beautiful home. Everything's the same. The only difference is that you look and feel 1,000 times better as a result of the surgery and then your work. You can't tell me it's not better.
Absolutely, it's better. And I think, growing up South Asian, I'm not Hindu, but I am Punjabi Sikh. And I think that is something of, it's almost like toxic spirituality and that toxic positivity that no matter where you are, no matter what, you should be happy. But if you have an opportunity to, again, add to the quality of your life and affect change, then why can't you have both? Why can't you do that? And so for me, it really did change my life. It changed my relationship to my body. And I always think that, before you're a great mom, you're a great partner, you're a great spouse, you have to be a great you. And I feel at home. And I think that if you look at it from a spiritual standpoint, we're all vibrating atoms. And I think when you're happy at your core and you're at peace with your body and how you're moving in the world, that's going to have a ripple effect in everything you do and everyone you come across.
And one of the things I like is that you and your husband are both into fitness, right?
Yeah.
Right. So that makes a huge difference because, often, first of all, it's easier to get in shape when your partner's in shape. It's easier to get out of shape and fat when your husband or your life partner is fat. It's easier to start smoking when they smoke. It's easier to gamble. Like, you guys are a unit. It's very hard to do things in isolation. So that's number one. So if an individual wants to get on a good path, it's good to take everyone with you. So that's number one. Secondly, I like the fact that, he's not just on the same path with you, but one of the things I recognize about your relationship is that he still had a lot of admiration for you in terms of partnership. Like, I have husbands that don't ever show up. I have partners that show up but are not present, but he was always present and he was there. And so that also is fantastic. That's not something you can just go home and switch. Your husband is or isn't, or your life partner is or isn't. But I think that's a huge part of your success, is that you had sort of not just a good husband who was supportive, but was really like in the same truck, going in the same direction with you. And the assumption is that this has enhanced your interpersonal relationship as much as it enhanced every other aspect of your life, because I can only imagine that it would.
Yeah, I think that when you're happy as an individual and you're at home and you're comfortable, that's going to translate into all your relationships, especially your marriage and your partnership. I have a wonderful husband, a wonderful partner who was supportive throughout my entire journey, even when I was apprehensive. And my biggest fears were, what is the anesthesiologist like? I remember calling the office and asking questions down to the type of sutures you use.
Yes, we remember.
And because I was like, what's going on in my body? Who's, all of these things. But really having his support. And if you ask him, he's like, you're just happier.
Sure.
And that's all I've ever wanted for you, is for you to find your happiness and your comfort.
Yeah, well, that's a sign of a good partner. And I think you touched on it a little bit. I think for people who are holistic, and I keep going back to this concept because I think that's the nuance of our particular conversation today, as opposed to just other abdominoplasty conversations. We find that the patients who are in your category tend to be more apprehensive and ask us more, I don't want to say esoteric, but more particular questions that perhaps show or emulate their fear. Because who gives a shit what goddamn suture I use? It's right. Not relevant. What's relevant is I'm here and I want to get here and I trust you as my professional. Carry me there. I don't go and ask my, my neurosurgeon what kind of clip he puts across that vessel. I just say, hey, I got an aneurysm, I need your help. But when it comes to this subset of people who are having a collide with what organically is the life that they lived with this concept which seems superficial, the way they want to grapple control over this is by pinpointing specificities of sutures and materials and what drug is it, and is it amnestic, that's it mind altering, and all that. We've heard it all, and we are empathetic to it because we recognize where it's coming from, because it's not relevant. It's just their way of trying to transition into acceptance that, oh my God, I'm about to do this. And so I want to feel like I've crossed my T's and dotted my I's, and I don't have any regrets to it. But I think it's interesting because at the end, they all come full circle, and they're like, wow, this was good. I needed this to get to where I needed to go.
Yeah, but I was definitely someone, who needed some hand-holding. I had questions. I was coming in of I'm very mindful of everything I put in my body. And so I think your team, shout out to Sally and Erica, but from the get-go, from my first point of contact, because this was years in the making of this decision of going and checking out different people and having consultations. And I wanted to be treated like a person, not just a procedure number. And that was the difference here, is that I had those questions, I had those fears. And also as a mother, I have a teenage daughter. And for me, it was like, what message am I sending her?
Sure.
Am I sending her that, she can't love herself at this juncture? And then I sat with it and I was like, anything you do, it starts with your why. If you're doing something to satisfy society or you feel like you have to, that's your why, and that's maybe the wrong why. My why was, I want to do this. Why? Because I want to feel at home. I want to feel whole in my body. And so that journey, looking back, I had all those fears, but they were really put to rest.
Yeah, we listen. Our practice is predicated on the academic or educational aspect of patient interface. We're not a practice that runs on turn 'em and burn 'em. We're not a practice that runs on marketing and Instagram influencers. Every practice has a brand, or at least a message that they put out there, that they use that messaging to ascertain patients. Ours has always been truth, transparency, and directness. That's the nature of it. Not because that's what we wrote down and now because it starts from the top. It's the way I run my life. It's the mantra from which I live my life when it comes to whoever I interact with. And our goal ultimately is to educate, within reason, educate you to the extent that we think you are now fully informed, and try to address your concerns irrespective of whether or not they're fear-based, irrespective if they're coming, wherever they're coming from, we need to answer them to get you to a place where there's a clearing, and that clearing says, okay, I'm ready to make the leap. Because at the end of the day, it's always a leap. Even if you answer every question there is, you still get to a point where you're like, oh shit, here we go. I'm going under anesthesia. I wake up. God knows I'll have a dead belly button. Oh no, I wake up and who knows where my scar is. Right? There is always going to be that leap. And our job is just to get you to a place where you can then surrender. Because at the end of the day, we got you. That's what we do. But of course we know that you would have apprehensions, and you're not unusual. I just find that the apprehensions of the holistic group of patients is similar in nature. Because it's this idea, as you said, what am I putting in my body? Is my body going to be the same? Because again, it's very counter to that universe. And what we're doing here today is saying, no, it's not. It's part of that universe.
Absolutely.
It's part of, it could be, it's available to you to get more holistic, more back return to home, more in better shape than you were before, which are all very much part of your belief system. But you needed a little help from the outside.
Yeah, I think it's a shift in thinking too. I think it's because society sends out these messages that it's got to be either this way or that way.
Sure.
And I think there's a beautiful mid-ground that you can be mindful in every aspect of your life, especially in how you care for your body. And this is one of the most caring things that I've ever done for myself.
Yeah, and that's good. We like that because ultimately we need the mothership to be on course for everybody else. We're grateful that you came and shared your story with us. I think It highlights a cultural change, because I think there's a lot of Indian patients that are now understanding that this is okay. Two, I think it highlights the idea that you can, as you said, be mindful, holistic, mind and body and soul and all those things, and still participate and dabble in plastic surgery. And lastly, once we're done with it, you got to carry the baton over the finish line. So for you to get a result as you have currently, you own that. That's yours. Nobody gave that to you. So that wraps up yet another episode of Plastic Surgery Uncensored. As always, we depart with two main requests. One being, if you like the show, you find it entertaining, educational, academic, what have you, go write something nice. Go write a nice review. It makes everyone who participates on this show feel like, you know what, it was worth a Sunday afternoon to come and sit here for hours. Secondly, share the podcast. Share it with people you know. You think that they're going to call you and be like, oh, hey, Sandeep, I heard that. Could you tell me? And you say, oh, yeah, I know this great. But by then it's too late. You're going to have friends and family who are going to go do things not telling you. Things will go wrong, and you'll wish they had listened to episode 7. Just send them the information ahead of time and let them worry about it. We think it'll be of great use to them. All right, well, that wraps up this episode. Thank you so much for coming. We always appreciate people putting themselves out there, and hopefully through your journey, somebody will make a good decision in theirs. All right, guys, we'll see you next week on Plastic Surgery Uncensored.